And we're live.
All right, so Senate Health Welfare back alive, and we are looking at H91 with Ledge Council to take a walk through again to understand what we're looking at, what the program looks like, and maybe some questions about what's new and what's old and what the administrative relationships are. So we can do some thinking over the weekend about any further questions or inclusions we would like to have in the bill, changes we might want to make. So we'll do that.
What happens if we don't do it?
If we don't do the bill,
Yeah.
then we'll keep spending $30 million a year on hotel and motel program. We'll have dysfunctional assessments and eligibility determinations and people who are unhappy.
So what, people are always gonna be unhappy
Yeah.
unless we can print money. So. Told you, I have concerns about shifting the responsibility to CAPS. I'm quite sure the CAPS are gonna lose some or not all of their funding. Washington just hasn't gotten that far down yet. B, once we ship it out and we relieve ourselves of paying every spring, every one of those CAPS said they can do it. And I have no doubt that they can, if we give them the money to do it. And they're all going to have administrative overhead, so we're gonna bleed off at the top. We're gonna relieve ourselves, because it's the CAPS, it's not us. So they're gonna get the grief every spring when we don't give them enough money. And I'm not sure why it's progress to do that.
So then the question is, how do we measure outcomes? What's the administration of the new administration of this? What's not working? What is working? So and then how do we find a solution? The solution may be partially or wholly here. So we can decide if there are changes needed to eligibility determinations, intake events, who does that, who collects the data to determine outcome measurements, how do we set benchmarks for reducing the number of hotel rooms and increasing shelters, and how do we link in with VHIP and other housing programs that provide more permanent homes for people. So we're looking at both a GA type program and we're looking at something else, getting people permanent homes. Okay. So we have whole lettered shelters, and then we also have programs that reach out to those people when they are in shelters and help them move them into a more permanent structure.
I have a question as to how frequently and how well that happens.
Services.
Putting all of this through economic services, which according to former Senator Kitchell, who used to head that section of state government, consists of 5 or 6 people who basically made sure you were eligible or not for food stamps and reach up, and we're nowhere near staffed to do any of this. And I doubt that they're staffed now. We hired somebody to answer telephones. To me, unless we talk about the resources and how we can more efficiently use the resources we've got. I mean, I find it, CAP and Good Samaritan Haven are both in Barry, my local capstone. Good Samaritan, the reason we've got fortunately more shelter space is because of Good Samaritan. So why don't we turn it over to them?
Well, so this is the question that a number of the local shelter groups have asked. So when I said we see 9 people, we have Groundworks, we've got COTS, Good Samaritan, got all of these that have done have been very effective. So how do you link them in with what the CAPS may or may not do, and with what the AHS may or may not do, and with housing? So let's go through the bill with all of these problems in mind, and then we'll sort it out. Go ahead.
Senator, thank you. Senator Cummings mentioned the staffing, and I'll be honest, when I read this, I think that was the first thing that popped into my head, the staffing, because people that work in this field of human services are the same, they're cut from the same cloth of the same people that work in mental health, find people. And we can't find anybody, and staffing is such a huge issue in human services right now. And so I just want to echo Senator Cummings' remarks, because it's the staff at all.
I heard it was 33% vacancy for at our mental health.
It's also quality of.
No, it's okay.
No, you're right, you're right.
Just instead of like positing our own impressions of things, maybe you should hear from AHS and get exact.
Well, I've asked AHS for some input on this, some language. So we had DCF yesterday, and the Deputy Commissioner Gray. So we will, and Lily Sojourner, who's the expert in the area at AHS. So we will, go through the information that you heard from them this weekend. We got some good handouts or PowerPoints on our webpage. And so my thinking today is go through, we all have these questions, we have concerns. So somewhere in the bill, we'll be able to find solutions. I don't know. The other thing that I heard from AHS yesterday was that the DAs and the SSAs don't always take seriously the work to add services in to the homeless program and be required to work with folks who are in shelters and motels. I can't say whether that's true or false, but they aren't directed in statute to do that. That's, I think, what they're saying. So maybe we make it a more firm commitment.
When you say DAs and assistants, do you mean like case managers?
I mean, like social workers, mental health counselors, those folks who actually work with clients.
I know the home health people are actively working in the shelter.
I know they are.
I don't know about mental health people. I assume they are still following.
I think they are.
Client that they had or that they picked up. But again, they're severely understaffed.
So that's a question we'll ask of the DAs and the SSAs, and we can also see what is or is not in statute relative to their statutory responsibilities.
Could we send an email to the CAPS asking them to give us an estimate of what kind of funding they need to set up and manage a program like this?
We have that.
We have submitted.
We've got that.
We have that language. Okay.
We have a fiscal note from the House bill to complete some of that. But Katie, so here you are, you're hearing we're all whining. But we want to fix, we want to fix what we can. So let's go through the bill. Can we skip over the findings again? Is that okay with everybody?
Yeah.
We'll come back to those.
Why have a green?
Your little green
Yeah.
flag.
Yeah.
Okay, and are we gonna skip legislative intent? Or should we go through this? I think, let's go through legislative intent the first time.
Okay.
Okay.
Is that moving important?
Office of Legislative Counsel. We're looking at H91 as passed House. And we're starting with legislative intent. It is the intent of the General Assembly that unsheltered homelessness be eliminated and that homelessness in Vermont be rare, brief, and non-reoccurring. It is the intent of the General Assembly that BHART, established in the chapter we're about to look at, is a step towards ensuring that homelessness be reduced in Vermont and interim shelter opportunities be available to provide a stable pathway to permanent housing for all Vermonters experiencing homelessness, including safe shelter options for individuals living in unsheltered homelessness. A step towards ensuring that Vermont increase the supply of emergency shelter as well as permanent supportive housing that meets the specific needs of individuals. Step towards ensuring that community components of all shelter types are integrated in a systemic manner. A step towards, what is the leave in? A step towards ensuring that time limits, night by night shelter, relocation between interim shelter sites and other disruptions in housing stability be eliminated to the extent possible. A step towards ensuring that Vermont's emergency housing statutes, rules, policies, and procedures and practices be modeled on housing first principles. And a step towards ensuring that non-congregate shelter be used to the extent
Can you
possible.
explain housing first principles?
The concept that a person first be housed before any additional services be required of them.
So they find a roof over their head and then there's an assessment of service needs or,
I mean,
because I would like it to be.
specific steps I cannot provide that.
I got it.
Yeah.
Well, I know, I think Frank may be able to, but
Can I ask a question while we're in a break, or not a break, but in a pause? Is there a definition, Kate, for interim shelters?
No.
okay, well,
Okay. Page 4 is the intent of the General Assembly that VHARD replace the provision of emergency housing through GA. And also replace the Housing Opportunity Grant Program. Then we move into the language of VHARD, we have the short title, and then the purpose. It's the purpose of the General Assembly to replace the provision of emergency housing through GA and use funds and resources previously attributed to those programs and any other identified state and federal monies to fund VHARD established in this chapter. And then we have our definitions. At risk of homelessness means in peril of imminently losing a primary nighttime residence or precariously housed. Community action agency means an agency designated pursuant to Title III. Community-based shelter.
slower,
Sorry.
where you're going, yeah, well, because we need time to process
Absorb it.
each
I hear
thing
you.
that you're saying,
Okay, I will slow down.
please.
Community-based shelter means a shelter that meets the department's standards for the operation of shelters. Department is DCF. Extreme weather event means an extreme hot or cold temperature or weather event such as hurricanes, flooding or blizzards that create hazardous conditions for outdoor habitation by humans. Homeless means lack of a fixed, regular, and adequate nighttime residence. Household means an individual and any dependents for whom the individual is legally responsible and who live and intend to stay in Vermont. Household includes individuals who reside together as one economic unit, including those who are married, parties to a civil union, or unmarried. Unsheltered homelessness means sleeping in a location not designed for or ordinarily used as a regular sleeping accommodation. Okay. And then we get into the program itself. VHARD is established in the department and shall be operated by Community Action Agency, a statewide organization serving households that are experiencing or have experienced domestic or sexual violence to the extent funds exist. And then we go on to list the different components of the program. Community action agencies shall collaborate with other community partners, including municipalities, the continuum of care, and local housing coalitions.
And so maybe, I know we've already had this, but just the balance of state continuum of care and the continuum of care, there are two different continuums. Do you want to just talk briefly about that for the entire?
I can only
You
talk
can.
briefly about that.
Okay.
Um,
Brief, that's
There, and you know what's missing from this? Are community agencies. The churches in Montpelier have been running for noontime feeding for years. There's one of the churches every day of the week does lunch. They have been providing heating and cooling shelters. They have been providing overnight shelters in extreme weather. They are a basic component along with food shelves and other facilities that, and they're probably more on the front lines.
So
than
I'm seeing
any other
that-
group.
I'm seeing that the community action agencies will collaborate with other community partners, so that's probably the umbrella for community partners. Okay,
I would say the community partners should collaborate with the CABs. I
Yeah,
think
you got it.
they've been doing.
I agree with you that
The
that community
reverse.
partners would definitely cover faith-based groups, which is, I think, what the legal entity. But it does also say including municipalities, so it does pull out one of those people that would be covered under community partners. And I think
who does it pull? Oh, you mean,
that it
oh,
says including
you just wanna add
municipalities.
more under.
So I was just saying, I think Senator Cummings is a big point, you know,
Yeah.
up in my area, the faith-based organizations, especially in Newport, they all give money and resources to the United Church in Newport, and they do all the
Yeah,
kitchens
here
and stuff.
We got that.
It's Christchurch,
Yeah,
and
but-
that they actually in November collected money and allowed
That's cap.
vulnerable families that were being put out between October and November to stay in the motels. They paid for the motel rooms.
But I mean, the churches aren't part of this, CAP. They're not part of the CAP.
No, they're not.
Caps are federally.
They're federally
They're
funded.
federally funded.
Separate agency, separate organization.
Well, we don't have to hear from anyone else today.
We'll get there. Let's go through this first. Right now, we just need to put this in our heads. Then we can start having we're not ready for that yet.
Okay.
This section goes on to say that the program is to utilize coordinated entry and shall utilize but not duplicate the work with community partners. So the discussion in human services was that this was meant to capture that we're building on work that's currently happening. And then the components of BHART that the community action agencies are responsible for are supportive services, extreme weather shelters, and emergency shelters. We have a section on each of those that we'll look at in turn. And then subsection C recognizes that BHART is to include supportive services and shelter services to households experiencing or have experienced domestic and sexual violence. So now we turn to each of those parts. So 4 parts of the program, 3 parts administered by CAPS, 1 part specific to sexual and domestic violence. Okay, supportive services. The Community Action Agency, in collaboration with other community partners, shall cause to be offered the following supportive services, which may vary in terms of manner and extent depending on the level of shelter a household utilizes, or whether the household is at risk of homelessness or experiencing homelessness. Intake assessments and services for diversion from
So
homelessness.
let's just stop at the word collaboration with other community partners. And so we're talking supportive services. And do we define supportive services anywhere?
No,
Oh, okay.
that's true. It's not in the definition section. But then this section goes on to sort of list
What might be there?
so, well, it's not defined as in a defined term. I think you could take this list as what is being included as supportive services.
Yeah, I would regard this whole section as the definitions of services.
Well, let's find out.
Intake assessments and services for diversion from homelessness. Household needs assessments. Individualized household plans to address identified needs. Assistance obtaining and retaining housing, including financial assistance. Referrals to other services and supports. Peer supported services. Landlord tenant outreach, education and conflict resolution. Housing navigation services. Advocacy and progress monitoring and intervention.
So, hang on a second. There's nothing here about financial, is there financial management? Yeah, there is, number 4. And, peer supported services, other services and support. There's not a real delineation of mental health, substance use disorder, recovery, referral to recovery. There's nothing that really is very highly specific, but we might want to add including. So we want to include some of these things that are sort of critical. Go ahead.
I believe subsection 5 might fill that referral officer.
Well, I know it's other services and supports, but that could be going to the garage and stick your car. I'm saying what we need is mental health, substance use disorder, and the things that we're hearing about, medical, referral to a primary care clinic. There are things in here that people need, basic needs, food. Okay.
For that, for supportive services, I'm on page 8, moving to extreme weather event shelter. Community Actions Agency shall operate or cause to be operated shelters in the state that shall be used during extreme weather events to shelter any homeless individual who seeks shelter. The Community Action Agencies, in collaboration with community partners, shall prioritize funding for extreme weather event shelters by utilizing data available under this section and considering geographic access.
So. Operate or cause to be operated. Okay.
Do they already operate shelters, the CAPS?
Some of them, yeah. Some of them better than others. But then we also have local community services.
Right.
Like COTS in Burlington,
Yeah.
they have shelters.
Yeah.
They have
Yeah.
extreme weather, they got.
I don't think attached them as
Right.
shelters.
Some do. You just.
Yeah,
We utilize in our town, we utilize our Grange Hall. If somebody's typically lost power, whatever they need for electricity, we have generators. And we can still get, bring it to the Grange and they can.
so when that come in the hazard mitigation plan, the emergency,
Yeah, we did
state
that.
emergency
We
plan.
do that on that side.
Yeah,
Yeah.
I don't know that that will fit in with.
Yeah, that wouldn't fit in here because this isn't for homeless.
Yeah.
It's just for people that are stuck in their house and would go
Yeah.
to their trucks and bring them.
Yeah, exactly.
So they got power, for their oxygen tanks or what's it.
There's so much we're gonna be able to do. Okay.
A shelter offered pursuant to this section during an extreme weather event may include time-limited congregate accommodations and may be provided through agreements to municipalities and other entities. And if you remember, there's language in the sort of big report back that is expected that asks, or is that part of the report back or part of the department's responsibilities?
Yeah.
Either way, there
Find
is
out.
information coming back about where guidance for when these shelters should be operated. And there's also language that the location of the shelters has to be posted on the department's website. So we'll get to that later.
Okay.
Okay. Next is a section on emergency shelters. And if you recall, this is divided into 2 categories: temporary shelter and transitional shelter. Temporary shelter. At a minimum, a community action agency shall serve or cause to be served in a manner that complies with and builds upon federally required community planning process.
Okay, I want to stop right there. Okay, go ahead with the rest of the sentence now.
Households that are prioritized in need of the services of a temporary shelter. So that word prioritized is a distinction between A and B, the 2 types of shelter. So in A, much like we prioritize populations to be served, eligible populations, this type of shelter would be based on similar priority.
I guess what I need to know is what the federal requirements are for the community planning process. Right now, I'm a little bit concerned about the little black cloud of authoritarianism that might influence that planning process.
So my understanding is that the CAPS have planning requirements and assessment requirements. I think I heard that they would like to talk more about the different types of assessments that are required of them, so that can be integrated into the bill more clearly.
Camps are, at their origins, part of the war on poverty.
Yes,
As one of the first warriors, I was assigned to Montauk Community Action, Turtle Grant, Pennsylvania. That's their focus. They have a board that was designated. It may have changed, but I represented the city of Montpelier. There were low income reps there. But that's what they were set up to do. We're expanding.
yes. Oh, I'm very aware that we're expanding it, and while we're expanding under the state umbrella, but the caps already have federal requirements. And if the federal requirements say you cannot serve LGBTQ, that would fly in the face of what we need to do in this state.
They're just going to cut their funding.
Yeah,
That's almost guaranteed.
I know. Okay, we need to, obviously, they're doing really good work. And we don't want them to fold. At the same time, how can we're different, you know. We already have community-based services that are doing a lot of the work. And so,
Is this committee working on the assumption that we're going to do this? Or are we working on the challenge of how do we make the situation better?
yes,
Okay,
the latter. And this might be part of it, and we might modify this. I mean, one of the things I think is, instead of waiting 3 years, we put the timeline in a little bit faster. Things like that. And then where do the responsibility lie? Where do the responsibilities lie? When? So, yes,
I mean, we've all heard that HOP is a very successful program. We're taking that out of OEO and we're putting it on the caps. We're also giving caps what's been dealt with by state agencies, general assistance. We're putting that all on them. To do that without, and the reason we have a problem is because we aren't adequately funded. To ask the caps to do this without a serious discussion of the resources necessary.
we do have some of that.
It's,
So let's keep going, and then, yeah, we hear it loud and clear. So we're right at the end of that sentence.
Okay. Community Action Agency may provide or cause to be provided temporary shelter through community-based shelters, temporary use of hotels and motels, lease agreements for full or partial use of an existing building, need specific shelter arrangements or other arrangements or combinations of arrangements that comply with the intent of this chapter. And then we have the transitional shelter, which does not have that prioritization component. Community Action Agency shall serve or cause to be served households in its region in need of services of a transitional shelter in a manner that complies with and builds upon the federally required community planning process. The Community Action Agency may provide or cause to be provided transitional shelter through community-based shelter, master grant leases, developing shelter capacity, or other arrangements or combinations of arrangements that comply with the intent of this chapter.
Can you give an example of a transitional shelter?
Well, we don't use that language here about hotel or hotels, so I would say it's an open question because it does say other arrangements or combination of arrangements.
When I think of the word transitional, I think of people coming either out of prison or I think of people moving into a recovery setting, and that's why I'm not sure how this fits. And
yeah.
different meaning.
There's different meanings of the word transitional. My impression from the conversation in human services was it wasn't that type of transitional necessarily, although folks could be,
Yeah.
but they could also be eligible for other programming under subsection A.
Okay.
But the focus, I mean, the language here also calls out community-based shelters as in A. So those are shelters that are following DCF guidelines. But here, like the master grant leases, developing shelter capacity, there seems more of a focus in this language of developing longer term or permanent solutions, like the developing shelter capacity that feels more longer term in nature. So, right.
Well, we have temporary shelter, we have transitional shelter. We have extreme weather shelter.
So
Okay,
this could be a place where you want to think through what the shelter components are and how they're distinct from each other. Okay. And then we are at the fourth. I said there were 4 components of the program. This is the 4th component of the program, 2208. So as part of VHARD, the department is to enter into agreement with an organization focused on domestic and sexual violence. The organization shall cause or cause to be provided various shelter and case management services that support households. Okay. And then in 2209, we get to what are the duties of the community action agencies under this program. So they have other, I think we all know this, but it's worth saying the CAPs have other responsibilities that aren't specific to VHARD. This is what are their responsibilities specific to this new program that's being created. The community action agency shall serve or cause to be served households that are experiencing homelessness or that are at risk of homelessness in the state by providing supportive services, extreme weather event shelter, and emergency shelter. We already know that. We just went through each of those components. The community action agency cannot fulfill its responsibility if a community action agency cannot fulfill its responsibilities under this chapter. The department shall work with other community action agencies or other appropriate community entities to ensure that there is not a gap in services in a community action agency's region.
okay, so it sounds like department is distributing resources to each of the community action agencies based on what the community action agencies say they can do at a specific time each year.
It doesn't specify, it just, if at some point in the future, community action agency can't do this work anymore, authorize the department to first look to, well, not even first, it can look to other community action agencies or other appropriate community entities to ensure there's not a gap. So it's not necessarily saying annually they're checking in to say, can you do this? Although that could probably be part of the authorization for the funds.
Yeah. Okay, well, could go, and I think some of my questions will get answered.
And so section B, community action agency providing or causing to provide services in accordance with this chapter shall have existing or planned infrastructure to support households in the region, including an established leadership team, human resources staff, and the ability to receive grant funding and issue subgrants. Have the ability to meet the department's reporting requirements, including past history of reporting compliance. 3, have community connections with other providers in the region, including local housing coalitions, housing providers, providers of coordinated entry, and providers of services to individuals who are older Vermonters, individuals who have mobility, substance use disorder, or mental health condition, individuals re-entering the community after incarceration, individuals transitioning from the care and custody of DCF, and families and children. And lastly, provide plain language communications to households receiving services. So those are the responsibilities of the CAPs prior to, or as part of participation in VHARD. And then at the top of page 11, we flip and now we're looking at the duties of the department. And you'll see that the sentence in subsection A, now we're bringing in the agency. So far, we've nestled this program within UCF. And the responsibility here says that AHS, working with the department, has statewide responsibility for meeting the intent of this chapter. Included statewide planning, system development, and involvement of all of the agency's departments. For the purpose of providing administrative oversight and monitoring of the program, the department shall. So we're going into the list of the department's responsibilities. Adopt guidance regarding when extreme weather event shelters shall be operated, including flexibility for regional weather conditions. We maintain a website with the locations of all of these shelters. Include as part of any review of a community action agency required to Title III. So as part of any existing review of a community action agency, the community action agency's ability to perform the requirements under DHAR. In subdivision 3, consult with the community action agencies and the statewide organizations serving individuals with domestic and sexual violence, who have experienced domestic and sexual violence, to develop appropriate resource allocations and methods for adjustment that take into account available data, the presence of community-based providers, and customary resource allocation methods, economic indicators, rate of homelessness, rental vacancy rates, and other variables as appropriate. So this is directing the department to work with the different, the CAPs in the network to figure out what is the appropriate way to distribute these resources. And these are all the things to take into account in doing that. And then in B, it's giving the option of how to distribute the funding. So the funding is annually distributed to each organization doing this work, or the department and the community action agency that they agree to a joint allocation for all the community action agencies, which the community action agencies then distribute amongst themselves. So that's the parent-child network model. So there's an option for that. Section 4.
Oh, let's go slow down.
Thank you. Good reminder. Section or subdivision 4. Consult with community action agencies and the organization working with households experiencing domestic and sexual violence to develop appropriate measures and methods of accountability of the community action agencies and the statewide organization. Excuse me. Their execution of this chapter, including the provision of any previously agreed upon information to enable the department to evaluate the services provided through grant funds, the effect of households receiving services, and accounting of expended grant funds. So again, this is telling the department one of their responsibilities under this program, or the agency, that some of their responsibility under this program is working with all of the relevant entities to decide what the appropriate measures are for determining the accountability of the CAPS and the domestic and sexual violence organization. How should their accountability be evaluated?
So when it's about the grants that we're talking about here, are the grants from to where the grants are going from the CAPS? Or is it grants
I think
coming
it could be
from
both.
the department?
I think it could be money coming from the department to the CAPS and the network, and I think it could also be sub-grants from the CAPS and the network to community
So
partners.
what we're doing is we're setting up a grants program at the CAP level that will go to the local organizations. And the CAPS will become the administrator of the funds. So they get the funds. And then they develop a grants program. So that so they can give money to the different organizations in their area as they see fit.
I'm seeing it one, maybe there's that level. But I'm reading this to say that the CAPS will apply for a grant. And they will get a grant, which then they can sub-grant. But
Yeah, that's
to
what I'm
date,
talking about.
that's been the only funding, but who else is in competition for that grant? Can Good Samaritan Haven also apply?
That is, this is written.
Yeah, so so we're gonna have to sort out
Yeah,
that process, that administrative process and what it means. So if you, and I think it's one of the concerns that we're hearing from some of the local organizations like Good Samaritan. We'll sort that out.
because I haven't heard from,
I've heard from mine.
okay,
I've heard from a couple.
we should have.
That's a good question. Katie, I don't remember, is there anything in this bill that contemplates or talks about or produces actual houses, actual buildings? No, okay.
It's not a
That's why I had,
permanent housing bill. It's a
that's why I
what
had,
happens in the transition between somebody being homeless and somebody be placed in permanent housing. In theory, like the language is flexible enough. Remember, we looked at what the transitional shelter was, and it talks about developing capacity. So what does that actually look like? It could lead to something more permanent.
Yeah, okay, I mean, I really don't need to sound.
I don't know, but we're trying to figure, look at,
This all,
there's a lot that we can do.
Yeah.
Yeah, I hear you.
yeah, but it's all kind of moot until we actually have buildings and houses and facilities. I just, it seems like I like this, but it seems like a cart before the horse. And as we're contemplating more economic hardship, we're probably also contemplating more people being homeless. And and I'm imagining folks who don't necessarily have a lot of mental health issues or other issues. They just simply lost their job and
Financial issues.
financial issues.
Right. I know.
So anyway, I'm just sharing that.
Good, good
If you're
share.
listening.
Senator Douglas?
I agree with Senator Gillig, but I will add on it that, you know, there's different things about this that I either don't like or am ambivalent about. Packet, but I do see it as a way to network between the various cabs, and I think it's a good framework for building a good system. So maybe it's not either the cart or the horse, maybe it's those connecting pieces, it's the harnesses, you know. Yeah.
Exactly.
I think they're doing it. I mean, I'd like to know from them what they're seeing as the road before we impose a whole new set of responsibilities. And hey, they aren't state agencies. I'm not sure we can require them to do this. It sounds like we may have grants that they can apply for, but you may find some of the smaller ones don't want to apply for it.
Agreed. Yeah.
And then what happens? And you know, COTS may well be in a better place to do some of this. None of these places have the ability to build housing. They don't have that.
Well, that's why I brought
I mean,
ACCD and RV
Yeah.
to look at some of those. Can we do something, given our time?
Yeah.
Let's finish up to page 13, yeah, to 2211.
I just think we should kind of work right back to the housing committee.
No, it doesn't go that, no. No.
No, we should be complete.
Oh, we are. Sorry.
Okay.
yeah,
Subdivision 5 provides support and technical assistance to the community action agencies, other community partners in the statewide organization for people experiencing domestic and sexual violence. Page 13 identifies specific administrative resources that could be transitioned to community operations. Develop and submit standards for the operation of community-based shelters. So remember our definition of community-based shelters, that it was an entity following DCF's guidelines. So this is sort of telling DCF to set up those guidelines. And then adopt the rules for the implementation of the program. Do you want it to keep going?
No,
Okay.
we're gonna stop here. We are going to read pages 1 through 13 over the weekend. And we're gonna look at the testimony a little bit, and then on Tuesday, I've got you scheduled on Tuesday.
Great.
To do it again. But we'll start on page 13.
Okay.
Thank you. This is good. Go ahead, Senator Douglas.
Yeah, if I have a minute, to ask you a question. So going back to all of the spots and grants, and money and providing funding to apps. Is there already existing in the bill, or would it be possible to add in like an annual or biannual reporting from DCF on like an audit of what the different caps and what the sub grants are being used for, and just making sure that it's effective use of resources for what we're getting out of it?
Yes.
Because it kind of feels like once the grants are issued, it's kind of they go poof and they're off into the
Well,
stratosphere.
but let's just, I guess that would be quite a Herculean thing, I think. But
There is, well, two things. One, there is like reporting language, but I don't know if it gets as specific as you want to the subgrants. I'm also thinking that this committee receives, there's language in statute
Yeah.
that AHS every year has to provide or report to this committee and other policy committees with all of the grants that it's issued. Like there's supposed to be an inventory of all of that. So that's in statutory language now. I don't know if it extends to subgrants though. And I don't know that you've received it in a couple of years, so if that may be moved anyway.
And I can tell you when that happened. It happened when I asked a question about how the grants are administered, because the DAs were very concerned about the level of scrutiny they were getting, and they had, the reporting they had to do. So we went through and looked at their grants and did make some changes. So it is worth looking at that report. I don't want to fill the bill with things that get in the way of building housing and moving people into it.
You know, if our housing committee is looking at modular homes.
I think VHCB is the place where we want to land with this. And they're doing a lot. We're looking at it down appropriations. Economic Development has already looked at it. We've looked at it in the past.
What modulars?
Housing generally.
Okay.
And what kind of affordable housing is being built where? And is it meeting the needs for each location? And how fast is it going? A lot of it. So, and a lot of the problem is that when you ask a developer to build a house, whether it's affordable or other, they have to make a living on it. And there will be. Huh? And have a profit.
Well, I also wanted to ask someone the other day, how much is like Vermont's really, not in my backyard, we have culture of that. How much is that blocking housing?
I haven't heard any recently, but maybe.
Low income housing and shelters.
No, we need nice housing up here. Went to the planning commission and they cut back the number of houses they were planning because neighbors didn't want traffic.
Right.
And you're talking maybe the difference between 15 and 20 houses.
Oh,
So yes, it's still up.
all politics is local. So
I have that book.
we, huh?
I have that book.
You do it. So we are going